Do you find yourself going into work each day dreaming of all the things you're going to do when you retire, only to wake up to the fact that you need to keep working for health insurance? As a certified financial planner, I hear from people all the time that say, I can't retire because there's no good health insurance options before Medicare age of 65. But today I'm going to bust this myth and share 8 good options for health insurance if you want to retire now, 2 of which might cost you nothing. So buckle your seatbelt and definitely watch until the end so you can catch all of this and make a more informed decision about your upcoming retirement. The first place we'll start that you may already know about is COBRA. But what exactly is COBRA? It's the continuation of group health insurance you're already on. It's the same plans with the same deductible, copays, networks, and same out-of-pocket maximums. In a perfect world, everyone would go on COBRA because it's easy and it's what you're used to. Now, the downside is it's not a forever solution. In most cases, the longest you can be on COBRA is 18 months, unless there's a death, a disability, or a divorce. But the bigger deterrent is the cost. While you work, your employer pays for a significant portion of your health insurance premium, usually in the neighborhood of 75 to 80% of the cost. And if you haven't notified your employer yet that you're retiring, you might not be comfortable asking for a quote on COBRA. But I'm going to let you in on a little secret. It's super easy to figure out how much your COBRA premium will be. If you have a recent pay stub, all you have to do is add the employee cost of health insurance to the employer cost of health insurance, and that's your COBRA premium. If you don't have a pay stub, you can usually guesstimate about how much this will be by multiplying your cost of health insurance as an employee by 4 times, since many employers usually pay around 75% of the cost of health insurance, although this varies. So if you currently pay $250, you might expect to pay around $1,000 a month under COBRA. So given the high cost, why would anyone want to go on COBRA? Well, there's a lot of reasons. Take Diane, for example, a client I recently helped retire. She's been dealing with an immense amount of medical bills, and she'd already hit her deductible and out-of-pocket maximum only a month into the year. For her, COBRA was the best option because all she had to do was pay her premiums, and all her medical bills and prescriptions were paid in full for the remainder of the year. Another case I was working on was an ultra-high net worth client, Bill and his wife, who maintained residence in 3 different states. Their priority was to have a PPO health plan with broad coverage across the country, and cost didn't matter. COBRA was a perfect fit for them because they were able to continue their PPO plan they were accustomed to. Now, the second option for health insurance is employer-sponsored retiree insurance. This sounds the same as COBRA, but it's something entirely different. This type of health coverage is provided by an employer to its retired employees. The plans often extend a similar health benefit as provided during the employee's working years, including coverage for a spouse and dependents, though sometimes with modifications. It's generally a lot less expensive than COBRA, but not as affordable as when you're working. Eligibility does vary by employer, but often depends on your years of service, your age at retirement, and the terms of your employee contract or union agreement. Now, if you're starting to have FOMO hearing me talk about this, let me just say that this option has become increasingly rare, about as rare as pensions nowadays. So I'm not going to be spending much time on this option because there's lots more amazing options to come. If you do happen to work for a large Fortune 500 company and you're a long tenured employee, there's a chance that this is a solid option for you. But I want to caution you that it's not always the best option. So it's good to educate yourself on the other options I'll be discussing in this video. The next option is one you definitely don't want to miss. It's one of my favorite options because a lot of times we can get health insurance for free, which can be a savings of upwards of $10,000 a year or $20,000 if you're married. It's also typically the option about half the retirees I help decide to go with. So I'm going to be going into a ton of detail about how this works. This is the Healthcare Marketplace Insurance, also known as the Affordable Care Act or ACA insurance. These are health insurance plans that are available through the healthcare.gov federal or state marketplaces. Now, traditionally, you'd enroll in these plans during the open enrollment period between November 1st and December 15th. But when you retire and lose group health insurance coverage, that counts as a special enrollment period. This allows you to enroll in a new healthcare marketplace plan outside of that open enrollment window. Now, one thing to keep in mind that does not count as a special enrollment period is the elective termination of COBRA. If you want to leave COBRA, you'd have to either wait until the end of the calendar year to enroll during the open enrollment period, or wait until the typical 18 months of COBRA coverage ends for a special enrollment period. Now, once you start comparing plans, you will notice the deductibles and out-of-pocket maximums tend to be higher than you're likely used to. And so these plans are not always a great fit if you're experiencing a lot of health issues. There are also many states that do not offer any PPO plans. Typically, their HMO or POS plans are the only ones that are available, which means you're going to have more restrictions with doctors and networks. The other thing you'll notice might be a little sticker shock like COBRA because the premiums you pay aren't being subsidized by your employer anymore. However, in a moment, I'm going to share some tips and strategies to maximize your savings and potentially get you a plan at little to no cost. But first, let's talk about the benefits of ACA plans because there's many of them. The first is insurance companies cannot deny coverage or charge higher premiums based on pre-existing health conditions. This ensures that individuals with chronic or past health issues can obtain coverage. Now, the next benefit of ACA plans is they cover many preventative services, including an annual wellness visit, immunizations, and screenings without requiring any copays or deductibles. This even includes expensive preventative screenings like colonoscopies, mammograms, and cervical cancer tests. Now, this encourages early detection and management of health conditions, even checkups that involve hypertension, obesity and weight loss counseling for those with BMIs over 30, and diabetes checkups are generally offered at no cost. And let's not forget mental health services, which is another benefit of ACA plans. Now, some of these services are no cost, such as depression screenings, and ACA plans also have consumer protections in place, one of which is a ban on lifetime and annual limits, which means that insurance companies cannot impose upper limits on how much benefits they provide. So if you need $5 million worth of care, the insurance company is on the hook for paying that $5 million. And I find this especially important for clients that have accumulated a significant net worth to protect them from unplanned health expenses. Now, the last benefit, which also leads us into the steps you should take to compare ACA plans, is the transparency it provides. The healthcare.gov marketplace allows consumers to compare plans side by side, which can lead to better decision making. So by now you might be thinking, Ryan, I get it. ACA plans have great benefits, but how do I see if an ACA plan might be a great fit for me? And also, how can I strategize to get a $0 premium plan that you're talking about? Well, to show you, I'm going to walk you through a real life case study I did for Bill and Jane. Now, Bill and Jane are a lot like many of the clients I help that are retiring before age 65. The numbers are different, but the principles are similar. At the time, Bill had a 40-year career in sales at a local manufacturing facility, and Jane had just as long of a career in pediatric nursing at a local clinic. Now, Bill and Jane emailed me one day saying, "We've enjoyed our careers, but we're ready for the next chapter of our life. A life filled with more grandkids, more time to travel, and the opportunity to pursue our hobbies," which for Bill was photography and for Jane was gardening. As you've shared with us in our meetings, we have enough money, which keeps getting greater with each year that passes. But our time keeps ticking away, and our health is probably the best it'll ever be. We've decided we're going to retire at the end of the year, which was age 62 for the both of them. After comparing their various health insurance options available, they ultimately decided that an ACA plan starting January 1 would be the best fit. And we continue by totaling up their income sources, since this is the first step in determining how much of an health insurance subsidy Bill and Jane would receive from the federal government. So Bill is starting his Social Security benefit, which will be $22,291 for the year, and Jane's will be $26,184. Bill also gets a small pension of $1,500 a year. They have dividend and interest income projected to be $29,362. And because we're using exchange traded funds as opposed to mutual funds, and also tax law optimization for selling within their brokerage portfolio, the projected realized capital gain income is only $846 for the year. This brings their total income to $80,183. When we plug these figures into the cost estimator on healthcare.gov, we get a premium tax credit of $1,311 a month. Bill and Jane are in good health and aren't on any expensive Tier 3, Tier 4, or specialty prescriptions. So when comparing the options available, they thought a bronze HSA plan with Blue Cross Blue Shield costing $14.33 and 64 cents a month would be a good fit, which means that their net premium after the tax subsidy is applied is $122.64 a month. But we aren't done yet, because we can lower this even further by funding a health savings account for each of them. So not only can they fund the family HSA maximum, but they can each do an over age 55 catch-up contribution. In total, they decided to fund $10,000 in an HSA, which was just below the max they could do. This dropped their income to $70,183 and increased their tax credit to $1446 a month, just north of the monthly premium. Bill and Jane were shocked. "You mean to tell us that we are retiring 3 years before Medicare age and we can have health insurance at no premium that also covers all our preventative services? We can't wait to take our grandkids to Disney World." The key takeaway here is that insurance subsidies are an income test, not an asset test. What if I add that Bill and Jane's net worth exceeds $5 million? Do they qualify? They do. They still qualify for free health insurance, and all it took was some planning and strategy. Since income can easily be manipulated up or down, unlike assets, this gives Bill and Jane flexibility over how much they pay in health insurance premiums. This came in handy because after finishing up the application, Bill asked what would happen if his photography hobby turned into several paid gigs for which he earned, say, $12,000. Well, this would bring their household income to $82,183, which would lead to having a monthly premium again for health insurance. Now, one solution I shared to this scenario was to fund a traditional IRA for Bill using $6,000 of his photography income, and then fund a traditional IRA for Jane by completing a spousal IRA contribution. Another option, since this would be self-employment income for Bill, was to open a solo 401k. Either option would reach the same result by lowering income by $12,000. and maximizing the tax credit to yield a $0 health insurance premium. Now, if income was even higher, we could employ additional strategies like tax loss harvesting and maximizing above the line tax deductions. And then another tactic I also like to look at is the distribution strategy, which plays a key role in how much money could be distributed for expenses without generating income. This would include things like leaning on excess cash reserves in bank accounts, or we could even take a distribution from a Roth IRA, as neither would increase income. Now, this next option we will discuss is an alternative to traditional health insurance. So let's address it. This is healthcare sharing ministries. These are organizations that are faith or community based where members share health expenses. The most common ones in the U.S. by member count are Christian Healthcare Ministries, Samaritan Ministries, Christian Care Ministry, and Liberty Health Share. These plans work by having each member contribute a monthly share amount to a common fund. When a member incurs medical expenses, they submit their bills to the ministry. Then the ministry facilitates the sharing of the funds among members to cover those expenses. While this sounds a lot like traditional health insurance, it is not insurance, which leads us to the first drawback of this option. Healthcare sharing ministries are not subject to any of the regulations that govern insurance companies, which means there's no required benefits, no financial strength requirements, and no oversight of these healthcare sharing ministries. Claims are also based on the organization's values, which could be a pro or a con, depending on your viewpoint. If you personally share the same values as the organization, you will know that your contributed dollars are going towards procedures that align with your unique values. But for others who may have come down with a serious or life-threatening illness, you might expect the organization to pay for more care than they are willing to do. Also keep in mind that these plans have lifetime limits, typically of $125,000 to $250,000 per illness, which does not go very far if you get seriously sick. And for those of you with pre-existing health conditions, your enrollment options are very limited unless the condition is in maintenance mode. And once you do get sick, the problems don't end there, because when you go to the doctor and they ask for your insurance card, you have to say, "I don't have insurance," which means you will get billed and then have to wait for a reimbursement, which is commonly 3 to 4 months after you submit the 2 to 3 pages of reimbursement forms you will have to fill out along with an itemized receipt. And to top this all off, these healthcare sharing ministries offer coaching as a way to encourage patients to negotiate with providers for lower prices, which not only sounds dreadful, but is one of the main reasons we all get health insurance in the first place, to have our bills paid without the headaches and the stress. So despite these shortcomings, why are these plans increasing in popularity? Well, for one, the premium cost savings is significant, usually 25 to 50% compared to traditional health insurance. These plans also have a strong community built into the membership, with members often sharing prayers or offering additional support to those going through challenging times. Flexibility is also a plus, as you can typically choose your own healthcare providers, as they're not limited to specific networks like some insurance plans. I'll end this option by saying if you do consider this option seriously, make sure you do your homework and know exactly what is in the agreement, as this is not insurance. This next option might be a bit controversial, but it's honestly an option I've seen people do that want a phased approach to retirement. This is picking up a part-time job with health insurance. You might be surprised to hear that many companies offer health insurance to part-time employees as long as you work at least 20 hours per week. To give you an idea of what this might look like, I put together a list of 18 companies that offer health insurance for part-time employees. We've got Starbucks, UPS, JP Morgan Chase, American Red Cross, Costco, CVS, Staples, Lowe's, REI, World Market, Chipotle, Macy's, Home Depot, Trader Joe's, U-Haul, IKEA, Nike, and Amazon. Despite a growing number of companies offering part-time health insurance, this leads us to our first downside, which is these part-time jobs do tend to be much more competitive than other jobs. You also have to be careful with how much you earn, as if you're collecting Social Security penalizes you if you go over a certain earnings limit prior to your full retirement age, which is age 67 for most people. The other downside is that finding a work-life balance can be a little bit of a challenge after retiring from a full-time job, as it can take away from that retirement experience. And while some of you might only think about the downsides of a part-time job in retirement, it does allow you to phase into retirement and also earn a little extra money. You're also in a work environment that is generally a lot less stressful than the environment you came from. And possibly the most underrated aspect of keeping a part-time job is the social interaction it provides. Staying active in the workforce can provide social engagement and a sense of purpose, which are beneficial for mental and emotional well-being. Now, this next option is obvious, so I'll spend just a moment to talk about some considerations. This is health insurance from a spouse. The first thing you should know is retiring qualifies as a life event that triggers a special enrollment period, which allows retirees to join their spouse's plan outside of the open enrollment window. Now, this period usually lasts 30 days from the date of retirement, and given how easy it is to do, it's probably tempting to go this route if this is an option for your situation. Although I would encourage you to at least consider your other options, as this does come with a couple downsides. For one, you can expect higher premiums as spouses cost a lot more to insure than the employee typically, because companies tend to be less generous with the portion of the premium they pay for spouses. It's also important to consider how long your spouse plans to keep working, as the coverage is contingent on that spouse's continued employment. And if the spouse changes jobs or retires, it may result in a loss of coverage, necessitating a new plan. If you can put these things aside, there are several benefits of going this route. It's easy to enroll, it's easy to pay for, and at least one of you is already familiar with the coverage. It may also open the door to do a larger health savings account contribution if the spouse's plan is a high deductible health plan, eligible for an HSA. This allows retirees to continue contributing to an HSA until they enroll in Medicare, which provides tax advantage savings for medical expenses. So for the world travelers watching, up next is an option that might be an opportunity to not only get health insurance, but to travel early in retirement. I'm talking about Expat health insurance. This insurance is designed for individuals traveling and living outside the US for at least 3 months. The most common providers of this type of coverage are Allianz, Cigna, and Aetna. As you might expect, the insurance provides global coverage, allowing for coverage in multiple countries, giving you the flexibility to travel or live in various locations without having to worry about your healthcare needs. The benefits are also comprehensive and often include a wide range of benefits such as inpatient and outpatient care, emergency medical evaluations, dental and vision care, and sometimes even wellness programs. As great as this sounds, there are a couple downsides, including exclusions and limitations of maximum benefits paid. The cost tends to be cheaper than domestic-based options, but can still take a large bite out of your retirement income. Now, pre-existing conditions can be problematic. Some plans may include waiting periods or additional premiums for pre-existing conditions, while others might exclude it entirely. If you're the type that embraces the adventure of living abroad while ensuring your healthcare is well taken care of, expat health insurance might be an option for you. Now, this next option surprises many that they would even be eligible for it. We're talking about another free health insurance option that can be effective before age 65. This next one is Medicaid. Medicaid can be a valuable resource for retirees with a high net worth but a low income. Understanding how to navigate the eligibility requirements and utilizing Medicaid effectively can provide significant healthcare cost savings. So let's start with the eligibility for Medicaid, which does vary by state. First off, we have income limitations. Medicaid eligibility is set by states and is usually a percentage of the federal poverty level. Now, high net worth individuals who've structured their finances to have a low annual income may qualify. However, some states do have asset limits in place, which would disqualify many of you listening here. But do keep in mind that certain assets, such as a primary residence, personal belongings, and some retirement accounts, are excluded from the testing, again, depending on your state. Also, many states do not impose asset limits if you're under the age of 65. So, assuming you can control your taxable income, let's jump right into the benefits. First is the comprehensive coverage it provides. Medicaid covers a wide range of healthcare services, including hospital visits, doctor appointments, prescriptions, long-term care, and many more. There's also low out-of-pocket costs, as Medicaid typically has low or no premiums, deductibles, and copayments, making healthcare more affordable and accessible. There's also long-term care benefits, which Medicaid is one of the very few programs that covers long-term care costs, which can be substantial, and they're often not covered by Medicare. There's also preventative services, which Medicaid covers various aspects to help retirees maintain their health and also prevent costly medical conditions. So, having covered all the benefits, let's discuss the elephant in the room, the drawbacks. The one most people think of is the stigma of Medicaid. Given that Medicaid is a low income program, there's this natural stigma around utilizing Medicaid. But if you're eligible, the only person you're hurting by not enrolling is yourself. You may have a high net worth, but you've paid your fair share of taxes to the government, into the millions for many of you watching. So focus on the practical benefits and recognize that Medicaid is a legitimate option for those of you who meet the eligibility criteria. Then there's also the state variability, which we've discussed. Since the programs do vary by the state, the terms of the eligibility, the benefits, and the application process are all different. So definitely do your research to learn the specific rules for your state. Also, provider acceptance. Not all healthcare providers accept Medicaid, so I suggest you talk to your preferred providers and facilities to see if they accept Medicaid coverage. And with that, we've covered the 8 health insurance options if you're before age 65. I invite you to subscribe to my channel so you're shown more great content to make the most out of your retirement. And if you have questions, drop a comment below and I'd be happy to help. I look forward to seeing you in the next video.